Hello, my name is Sarah Sass and I'm a nurse practitioner with Peacock Pediatrics. And today I wanted to talk a little bit about car seats and car seat safety. So the American Academy of Pediatrics recommends that infants ride rear facing starting from the very first time they ride home from the hospital and then every single time after. They will remain rear facing in the back seat of the car for at least 2 years, so until they are over 2 years of age and or until they outgrow the weight requirement of the car seat. We want you to get familiar with the car seat. There is always a sticker on the car seat that will show the weight and height requirements, and then as well as an expiration date. So pay super close attention to those things. We don't want you using a car seat past the expiration date, and after your child's well-child visit, your child's weight will be on the paperwork. Always feel free to weigh your child at home and kind of know where they are so that you're using your car seat appropriately. Rear-facing seats. Infant car seats usually come with a base that is fastened into the back seat of the car, and then the infant carrier will be clicked into that. Both the car seat base and the convertible car seat should not move more than an inch once fastened into the back seat. If it does move more than an inch front to back or side to side, we would want you to tighten it a little bit better to this vehicle seat. Car seats are for cars only. They are not for sleeping, they are not for feeding, and they are not for use outside of the vehicle. Once your child is in the car seat, they should be buckled and strapped in. So once you place them in it, when you have an infant car seat in your home and you place the child in the car seat, we want you to strap them in using the 5-point harness. So the 5 points are over the shoulders, at the hips, and then between the legs. And that is super important. And then you can move them to the car. Don't ever leave them in a car seat unattended or on any kind of high surface, such as a table or a counter. They're safest on the floor, and then you'll move them right to the car. So the chest clip on the car seat should go across the child's nipple line, and the strap should be pulled snug. You should be able to fit your fingers underneath between the child, but you should not be able to pinch the strap. If you can pinch enough of the slack of the strap, then you need to pull it a little bit tighter. A common concern of parents are when their child is in rear facing and their legs are scrunched up and bent. That is a common concern we hear a lot. Injuries involving children's legs are very rare for a child in a rear facing car seat, and it is much safer for the child to be rear facing, even if they're uncomfortable with their legs. You should not add any accessories to the car seat that do not come with the car seat. So shoulder pads that are not already included in the car seat, any infant inserts, so nothing should be between the baby and the car seat. That just kind of messes with the integrity of the car seat and is not as safe. If your infant's head slouches, most manufacturers of car seats allow you to roll up a receiving blanket or a diaper and put it on either side of the child's head. But again, you should always be watching the child in the car seat, and they should never be in the car seat alone. The other thing we wanted to mention is your child should not have any bulky clothing on or winter coats in the winter while in the car seat. So they should have just a light layer of clothing on, nothing bulky in between them and the straps. You can place a zipped cover around the car seat in the winter time to keep them warm, but we do ask that you take the coat on and off as they get in and out of the car seat. If you have questions or need assistance, feel free to call us at Peacock Pediatrics. Our phone number is 816-396-6026. We'd be happy to help you kind of navigate through your car seat questions.